Good morning. I'm so pleased and honored to have with us Dr. William Wenner, MD. He is Professor Emeritus at Penn State University College of Medicine and currently is on the Pennsylvania Patient Safety Authority on their board. Dr. Wenner received his medical degree from Penn State College of Medicine and was trained in pediatrics at Stanford University Hospital in California. He completed his pediatric gastroenterology and nutrition training at the Children's Hospital of Philadelphia. Publishing over 40 articles and books, he has practiced at the University of California, Davis and the Children's Hospital of Philadelphia. Has a special interest in inflammatory bowel disease and worked at the Penn State Children's Hospital. Please tell us of the reason why you've been so kind as to become part of this initiative.
When I heard of this initiative, I was very impressed. These are the things that Pennsylvania Medical Society can contribute to healthcare, this type of activity. I do want to start off with a disclaimer that anything that I say is my personal opinion, does not reflect any organization I belong to, neither PSA nor Penn State. It is personally entirely my personal opinion. The whole evolution of what's happened in medicine through my career. I mean, graduated in '83 regarding the, for lack of a better word, the fiscal financial aspect, the reimbursement of physicians has been ground shaking. That physicians who previously were making patients based on primarily.
Yes, well, Dr. Wenner, I'm so pleased that you are going to share your perspectives. Please let me know what it was about the initiative that really got your attention, and please share the information you have with us.
First, I do want to give a disclaimer. Everything I say is my personal opinion, does not reflect any organization that I belong to, particularly the PSA or Penn State. This initiative that you've started is fantastic. It is desperately needed. The influence, the change in the relationship of physicians to payers, to patients is having significant impact on the quality and safety of care. And therefore, I was glad to volunteer to participate in this. I think it's very, very important that everyone involved, the payers, the physicians, the providers, the patients, understand the complexity of the current healthcare environment.
So, in looking at the various choices, practice models that are available to physicians now, large health systems, small, private equity, what do you see as the positive and the negative of each one, if you feel comfortable speaking about it, or any one in particular that you just want to speak to? Are there advantages for physicians and patients?
The system is changing so quickly. I don't know if I have enough experience to be able to comment on each of the different models. What I think is very important, though, is that we understand the influences of each model in terms of patient choice, physician involvement in those choices, the autonomy of the patient, the autonomy of the physician. And each one seems to grant different aspects. Certainly private practice, which seems to be diminishing as a percentage of practitioners, granted the physician and the patient a much closer, more personal relationship than the current environment, particularly then as physicians, as employees, rather than as self-practitioners, are under enormous external pressures that are becoming more and more difficult to balance.
Now, do you see a way that physicians can, in a sense, band together to regain at least a small amount of influence on some of the decision making that has disappeared with the diminution in private practice?
The way I would best describe the current environment reminds me of the quotation of Benjamin Franklin during the Revolution of "we all hang together or we all hang separately." Previously, when physicians were self-employed, they were able to exert greater influence. But I don't think that physicians as a group, we understand how to navigate the employer-employee relationship as we practice for our patients.
Well, what do you think is the best way for PAMED and this initiative that I have to try and educate our colleagues in medicine and bring them together so that they have a unified voice when dealing with whether it's large health systems, private equity, whichever they choose to do?
This initiative you started is a natural role for organized medicine for Pennsylvania Medical Society. This is the forum that needs to exist because there are no other forums that allow for open discussion of the circumstances that we are in. And that's what we really need, is people to be willing to vocalize the issues, to discuss them up front in a safe environment. And Pennsylvania Medical Society is the perfect place to create that environment.
Now, as your position in a government board of directors for the Pennsylvania Patient Safety Authority, do you think government is aware of the challenges facing physicians as they try to navigate the changes in healthcare? Or do you think they are sort of in their own cocoon, for lack of a better word, and not really realizing the impacts it's having on patients and physicians?
Well, I can't really speak for the Patient Safety Authority because our role is primarily organizational. From what I read and from my opportunities to speak with legislators and other politicians, they are becoming aware of it, but we as a profession have never really understood how to get our voice heard, our position at the table. And that's something that PMS ideally should be able to help us do that.
Do you think there's any particular movements that you've been seeing with physicians? I'll just bring up a few, and you don't have to comment on any of them. But one would be some of our younger physicians, but particularly our residents, have talked about organizing and unionizing, and some are already doing it. What ways? I mean, that's just one way. And again, you don't have to speak to it, but do you have any suggestions as the way to unify so that physicians have a voice?
It's interesting you mentioned the unions. I've been following those articles in the newspaper about the recent attempts to unionize the residents. It's also very interesting that it was the residents who have moved in this direction first, that the practicing physicians have not moved the employed physicians have not moved in the direction of unions. I'm not really sure why that has been. You have to be a little concerned that the focus of residents and fellows, those in training, may not be the same focus as the actual practice environment. There's certainly a need for a forum, whether it's through unions or through PMS, to become more vocal, to be able to represent the needs of the physicians. One of the things, unfortunately, we face with physicians is we're actually an amazingly, for lack of a better word, diverse employment and practice settings. It's people in academics, there's people in private practice, there's in small groups, and there's in large groups, and there are different perspectives. We're very much like the six blind men and the elephant. We all see one perspective. Sometimes I think we struggle to see the perspective of our colleagues, and that is where PMS can really help.
Given that most physicians now, and it keeps going up and up, are employed. Do you see any way back um, to more, not all, but more physicians going into a private practice? Or do you think that's over with the rise of the large health systems and private equity?
I'd say more than anything that the decision has been taken out of our hands as individuals. The cost of running a practice, the computerization, the regulations, the legal requirements have probably moved it out of the ability of any one individual. But certainly it would be a shame for the patients if we lose the benefits that were in place to the patient of that physician-patient relationship.
And that's the other big part that I often speak about is really the loss of the physician-patient relationship, and sort of going along with that, the way that things are so financially motivated, particularly in private equity models. They're very much pro-profit and not really pro-patient. So do you see any way for to get involved legislatively? There are some bills that are coming out to deal with private equity, at least in terms of having some oversight, not stopping it, not the American way. We are certainly a financial country, but we need some guardrails or oversight, it would seem, to make sure that our patients aren't hurt by some of these financial deals. Do you see a role in the legislature to help us with that?
Absolutely, the forum for addressing this will have to be through legislation. The beauty of legislation is that if all parties are willing to be involved, they can all have a voice. That way, the patients can have their input into the final structure. The providers, the physicians should have their voice. The payers need to have their voice. And the forum for that is the legislative process. What I see when I look at it historically, physicians have been so busy taking care of patients that they have neither the skills, the time, nor the inclination to get involved in legislation. I knew someone who once ran for governor not in Pennsylvania, but a different state, who was very, very pro-medicine. And the candidate commented that it was so hard to get physicians involved, that physicians sometimes look at politics as being negative, as being dirty, and want to stay above it. And what they don't realize is that if you're not involved in the legislative process, you're not having a voice in it at all. And they will make decisions without us. And so that's why, again, PMS is the ideally situated to be the voice of physicians with the legislature.
Is there anything in particular that you feel that our membership should know, that you can tell us from your experience, both in practice and now as an active member in our senior section? Thank you.
I was pleasantly surprised at how receptive the legislators and the executive offices are to the input of physicians. I won't speak for them because I completely, but I sometimes sense that they are aware that they are not the experts in this and they need the input of others. I was involved once with an organization that actually wrote legislation that got passed. And it was a fascinating process to see how the legislation moves through. Again, what I would stress to my colleagues, when I first started in this, I was very inexperienced and therefore very immature and did not realize the complexity of the process. But as I became more familiar with the way in which government interacts with healthcare, I began to realize it's a fascinating system and that we as physicians have much to offer if we are willing to get involved.
Wonderful. Let me see. The only other thing I would ask, and I know now think you're retired at this point, but just looking at everything, and you worked for many, many years in academia, do you feel that the academic model, since this was your area of expertise, has advantages over the other models that you might want to share with some of our members considering going into an academic practice?
There's no doubt that there are advantages to each of the models, and the academic model was attractive to me, but that was back in when I made my decisions back in the 80s and early 90s, because I had the autonomy to control my time. I remember one of my mentors who was encouraging me to go into academics saying to me that if they needed to spend 2 hours with a patient, they could do it without any difficulty. That environment doesn't exist anymore to that degree in academics. And I think academics is going through a very interesting growth phase, trying to figure out how to retain its patient-oriented academic intellectual approach in a fiscally competitive environment. And I don't know if it's solved that problem yet, but it is something that it is aware that it struggles with.
Very good. Have you had any experience or feedback from colleagues, negative or positive, about private equity involvement in healthcare?
I think all physicians are concerned about private equity because it is private equity by its nature is interested in making a profit. And the system, as it grew over the thousands of years of our healthcare profession, was never profit driven as a fundamental part of its structure. But private equity brings that to the table. And I think any physician who's paying any attention has to have some concerns about how this is all going to fall out.
Do you see in the next 5 to 10 years any particular model as rising to the top, becoming more prevalent, more attractive to more physicians, and really becoming the main choice for physicians? Or do you think there's a lot of volatility going on and we really don't know yet?
When I first became interested in the administrative, legislative side of medicine, I went and got a master's degree in public administration. This was during the Clinton administration, and I was certain that the government was going to run healthcare. Obviously, I was incorrect, and so therefore my ability to predict the future would be very questioned, and appropriately so. I don't know which model is going to come about, but I can say to you that if we as physicians are not actively involved, and I mean really actively involved in this, it will not turn out well for us. The decisions are going to be made whether we participate or not. And it would be a disaster both to the patients and the profession if we as physicians do not actively get involved in this issue.